Hi, ma'am. Dr. Cabral.
Hi, kamusta?
Yeah. Kamusta po? So, these are our your questions po. Is the treatment algorithm based on the Cairo Bishop classification? That's one of the questions asked po.
Yeah,
The one
so
that you presented earlier.
yes, yeah. Thank you very much, Dr. Noble, for your question. So the Cairo Bishop classification tells us how to diagnose tumor lysis syndrome. So it's the presence of the abnormalities, the laboratory abnormalities. So everything hyperphosphatemia, hyperkalemia, and hypocalcemia. And then at the same time, there must be clinical abnormality. So that's the way to diagnose it. But the severity is basically risk stratifying the patient, meaning even before we start treatment, we check what's the risk for the patient of undergoing tumor lysis syndrome.
All right. So hopefully, thank you po, Doctora. So let's go to Dr. Cabral po. Nowadays, there have been a lot of dietary practices such as intermittent fasting, ketogenic diet, and some diet gurus claim that this type of dietary practices help control the blood sugars. What is your opinion about it? Is it safe for diabetics and hopefully prevent the occurrence of DKA or HHS?
Well, a diet is a diet. No, if you eat less, that's less calories, less sugar. You should lose weight. The problem with doing certain kinds of diets depends really also on your control of diabetes at the time. Honestly, when you have diabetes is not going to go away just because you diet. Unfortunately, no, it's not that way. Unless maybe you eat fast food every day and you're 100 pounds overweight. You change your diet completely, you lose the 100 pounds, you exercise. I have seen it happen, but it's a very, very rare occurrence. But diet is still diet, no? And you should think of it really in a way of eating properly. So any diet that you see out there, intermittent fasting, the ketogenic diet, all of them, actually what they have in common is that they are low-calorie diets. So kahit anong diet pa yan, basta you eat less, you will lose weight, you will get better. Okay. But of course, if your diet is just full of sugary drinks, your sugar will probably go up higher. But if you consume, say, 1,000 calories of cake as opposed to 1,000 calories of pasta, that's still 1,000 calories. That's still the same amount of. Your blood sugar will go up, but probably not as much with the pasta compared to the sugary desserts. Now, going back to the ketogenic and the intermittent fasting. Intermittent fasting will only work if you eat less pa rin.
Yeah,
So, it's
I agree.
intermittent fasting is just like dati, you remember yung after 6 diet, di ba? You just don't eat after 6. Ganun din yun eh. You just don't eat for a long period of time. But when you can eat, dapat you eat lang the meals within those times. So for the new IF that they're doing, 16-8. 16 you don't eat, you eat. But within the 8 hours, that's usually just 2 meals and maybe a light snack. Not 3 meals and 2 or 3 snacks. Hindi ka rin talaga maglulose weight ng ganyan.
Agreed.
One last thing about the ketogenic diet. Okay, so you will hear a lot about people who lose weight, they do great, they post all of these pictures on social media, but you never hear about the ones who have developed high cholesterol levels, have had a heart attack, or developed fatty liver. The ketogenic diet is actually the worst diet out there because most people don't do it properly. And if you have uncontrolled diabetes, you can really push yourself into ketogenesis and ketoacidosis. No? So if you're going to do it, I would suggest you still do it under the guidance of a physician. It's usually a short-term thing. Sometimes it does promote jumpstart your weight loss. But honestly, it's not the way to do it, and not a lot of people can sustain it. Really, you can't do it forever.
Agree. To add on to what you said, Dr. Cabral, I think the most important thing is to exercise also to help control your blood sugar, your hypertension, your other comorbidities aside from diet. Because even if you do the diet but you didn't do any exercises, it's just a part control no with the medications also.
But ano din exercise can help you keep the weight off, but it's not going to make you lose a lot of weight. Honestly,
Agree.
it's still 95% diet. Because
Diet.
look, if you exercise regular treadmill, running 30 minutes, that's not even a cup of rice. Just to put things into perspective. Okay, so you really can't exercise a bad diet unless you're swimming like an Olympic swimmer and training like a marathon
At
run.
least.
It's very hard to out exercise that bad diet talaga.
Yeah. Okay. Thank you po, Doctor. So now let's go to Dr. Francia. One of the attendees had a patient daw po who had BROJ, biphosphonate-related osteonecrosis of the jaw. So what do you recommend on how to avoid it?
Yeah. So thank you for the question. First of all, it's very rare. It's less than 1%. But normally before we administer, as always, again, very thorough medical history. And of course, we check their teeth status. Number one, we check, is it majority dentures or do they have full teeth? If majority are still their normal teeth, we actually need dental clearance. So it's just so tricky now with COVID. Diba? How do you even ask your patients who are older to go to the dentist? So normally, if it's like most of them are older and mostly dentures, actually no need for dental clearance. So normally dental clearance is really the best way to prevent osteonecrosis of the jaw, but very tricky with COVID.
Okay. So thank you, pa, Doctor. Now let's go to Dr. Cabral. Can we give sodium bicarbonate if pH is 6.9 in DKA? I think you have mentioned this in your lecture a while ago.
Yeah, I mean, again, it also depends on the pH of the patient. But in general, again, 6.9 sounds like somewhere in the middle. Yes and no. I guess if your pH is very low, you can give sodium bicarbonate already to the patient, but just be careful, no? Because I've seen patients being given sodium bicarbonate over and over again, and then we lose sight of the sodium. So unfortunately, we did have a patient who developed cerebral myelinitis because of wide fluctuations in their sodium because of too much sodium bicarbonate. Work hand in hand with your nephrologist, okay? But really, it's not the bicarb that will help fix things. It's insulin. Insulin and especially if it's HHS, it's hydration. So those two things.
Okay. In corollary to the DKA po, Doctor, does checking plasma lactate play a role in the management of DKA in patients with sepsis?
So lactic acid can be elevated in several situations. But if you've identified that the patient has DKA, and it seems like they're not getting better as expected. Like I said, within 6 to 12 hours, you should have been able to close that anion gap and get your blood sugars under control. So if you're already hydrating, you're giving them insulin, their blood sugar is already controlled, but their gap is still high, then lactic acid can be something that you can check for, because the patient have lactic acidosis, not just because of sepsis, no? Because if you've hydrated the patient enough in a septic condition, the lactic acid should come down. So if lactic acid is still high, maybe it's a liver condition, or they have ischemic bowel. And we've seen this, no? In DKA, sometimes they have also abdominal pain. It turns out ischemic bowel pala siya, or a ruptured appendix, or it's cholecystitis. No? So those are things that we also should rule out.
Thank you po, Doctor.